ADHD and the female brain. What is ADHD? How does ADHD largely manifest in biologically female brains? ADHD, or attention deficit hyperactivity disorder, is a neurodevelopmental disorder characterized primarily by hyperactivity, inattention, and impulsivity. ADHD manifests in 3 types based around number of symptoms: primarily inattentive type, primarily hyperactive type, or combined type, where symptoms manifest equally as both inattentive and hyperactive. To get diagnosed with ADHD, a certain number of symptoms must be present in the patient before the age of 11 or 12 and must affect work or school for an extended period of time lasting longer than 6 months. This diagnosis is only valid where other diagnoses do not better explain the symptoms present. Too often, ADHD is characterized as something to grow out of, so many adults go undiagnosed. More significantly, women are even less likely to be diagnosed due to ADHD usually manifesting in the female brain as inattentive type. The inattentive type of ADHD has fewer external symptoms, therefore making it harder to recognize and diagnose. In addition, ADHD often manifests along with other disorders, which makes it much harder to diagnose ADHD as the symptoms may be conflated with other disorders like social anxiety disorder or autism. Like autism, ADHD is often studied differently and manifests differently in men than women, which increases the stigma around ADHD and in women and decreases the likelihood of diagnosis. But there is good news. The stigma around ADHD is changing, and there is treatment. Therapy and prescription medicine are known to be effective treatments. But the best way to treat ADHD long-term is also through self-care and healthy habits.